I'll say this because recently, the Kardashians, unfortunately, are sort of everywhere and you can't get away from them. But two of the sisters, it seems like there's some speculation that they've gone through like a partial sleeve, like a gastric bypass, because they've both lost. Kim, and I forget the other one's name, but she's blonde, has lost a lot of weight. Like they've lost a rapid amount of weight in a very short amount of time. And while they weren't obese to begin with, and maybe it's, kind of a, for whatever their lifestyle and their branding and whatever, what are some of the solutions that we might consider if we are obese and if an individual's listening and they are obese, or they have a sister or an uncle or whatever, whoever is obese? What are some of the things that are available to them? Is it bypass surgery? Is it gastric bypass surgery, partial or full sleeves? Is it just the prioritizing of sleep and barriers of entry, or is it really a combination of both? Like, how do we want to approach this, maybe as a whole, and if you can, to the individual, if it's possible?
Yeah, so I'm going to start off with the Kardashians because I think this kind of is a good segue. So I know nothing about the Kardashians, but one thing that has changed recently in terms of the tools that are available for a wealthy person like them to lose weight is the availability of these new weight loss drugs, the GLP-1 receptor agonists. And these include Wegovy, which is the brand name for the drug semaglutide, and
that's what I know. Yeah.
Mounjaro, which is the brand name for the drug tirzepatide. They're very similar drugs, but they work really well. And so I don't think that any of the Kardashians probably would medically qualify, but I mean, if you've got enough money, you could probably get your hands on it. And so, I mean, I would say that's a very good contender. I have no idea. I don't know anything about them, but I would say that's a very good contender for what might have happened there.
So you think it's more of a medication-induced weight loss versus maybe a sleeve or something like that?
Yeah, knowing nothing about the situation, that would be my first guess.
I don't either. I'm just so we're clear, I don't know them or treat them or speak to them. It's just my observation of like a very rapid weight loss in a very short amount of time, which would be, it seems super physiological. It doesn't seem like it's done naturally.
I mean, if you don't have obesity, I don't think there's a surgeon. If you don't have obesity and don't have other medical indications for bariatric surgery, I don't think you could find a surgeon who would do bariatric surgery on you. At least, I mean, you'd have to go like probably to the bottom of the barrel of like the most like disreputable foreign surgeon you could possibly find to even have a chance. I mean, that would be like just nonsense. On the other hand, these drugs, I think, would probably be a lot easier to obtain. And like thinking from the perspective of the individual too, like bariatric surgery, that's a major abdominal surgery. I think, putting myself in their shoes, I think these drugs would look like a much better option than having major abdominal surgery to lose like, I don't know, 15, 20 pounds. Like, yeah. So, I mean, again, I know nothing about them or what they're doing, but certainly that would be my guess. And so, okay. So you asked for someone with obesity, what should they be doing? I think, I'm going to broaden the question a little bit because I think we can basically divide this into two different types of people. People who don't have obesity, who maybe just want to lose a few pounds or prevent weight gain. And then people who actually have obesity and may face other health challenges like type 2 diabetes or joint problems or whatever else related to that. What should they do? Because I think those are two very different scenarios. I think for someone with obesity, I would highly recommend seeing an obesity medicine specialist if you're able to do that, because those people are going to be way more knowledgeable than your typical general practice physician in terms of how to treat obesity. Your regular GP does not have the tools to treat obesity. And that is starting to change, but right now they are just not going to have the best tools that are available. And so I'd highly recommend that if you can. And the tools that we have today for obesity are really good. Like I wouldn't have said that 20 years ago, maybe not 10 years ago, but today they're just way better than they used to be for treating obesity, both in terms of the excess body fat itself and the health consequences of that excess body fat, like type 2 diabetes. And so we have, basically one strategy you could consider with your doctor is you could start with behavioral weight management, which means like diet and lifestyle, exercise, see how it goes. And then if that doesn't get you to where you want to be, escalate to something more intensive. So you could consider these new medications like semaglutide, tirzepatide that I was talking about. These are great drugs. Like I'm going to sound like a shill, but I I have no conflicts of interest whatsoever with pharma. I just think these are great drugs, and they cause way more weight loss than previous weight loss drugs. We're talking about 15 to 20% loss of body weight in people with obesity. And the side effects in terms of health outcomes appear to be mostly positive. They reduce cardiovascular events. They greatly reduce the risk of developing diabetes. They help control blood sugars in people with existing diabetes or who might have prediabetes. They can even, in some cases, put diabetes into remission. So these are, and in terms of the risk, like they don't appear to increase cancer risk. Like they reduce all-cause mortality in people with type 2 diabetes. So in other words, overall risk of dying is reduced. So like the safety profile looks really good. The main drawback in terms of side effects is they cause gastrointestinal problems when you first are ramping up. So people can get nausea, diarrhea, constipation, things like that. Usually those go away once your body adapts, but in the beginning, those can be pretty bothersome. Very few people actually discontinue as a result of these side effects. So for most people, they actually really like being on these drugs, and the side effects are minimal after a certain period of time and very much viewed as worth it by both the patient and the doctor. So that's my kind of overview of those new drugs. They are very expensive in the US and not all insurance pays for them. In Canada, they're less expensive. I don't know the insurance situation. They're much less expensive in Canada, but still expensive. So that's kind of, that's the really new tool. And the last point I'll make about the drugs is that there's like an avalanche of awesome weight loss drugs that are going through the clinical trial pipeline right now. And the landscape of obesity treatment is going to be completely altered by this. In the next like 10, 20 years, I believe we'll be in a very different place with regard to obesity treatment. Then there's bariatric surgery. So bariatric surgery is actually a really great option. So it's actually cheaper than being on these drugs because the surgery is expensive, but in the long run, it's actually way cheaper to get the surgery. It's not reversible. So that's a drawback. If you have problems that result from the surgery, it's hard to walk that back. In some cases, it could be impossible. But these surgeries have come a long way. They're really safe now, and they're really effective. So vertical sleeve gastrectomy and Roux-en-Y are the two common, really effective ones. So I think that's actually a really good option still. But eventually it'll probably be displaced mostly by these drugs. So I would say that that's kind of like, that would be my main thinking on for people who actually have obesity, who want to do something about it, who want the most effective tools available. And yeah, those would be my thoughts. Now, the second bucket is people who just want to lose a few pounds or want to stop themselves from gaining weight. And I think that's the scenario where uh, behavioral weight management, so like diet and lifestyle, is really the tool that's going to stand out the most in that situation. So I think for that scenario, just there are many tools that I think could be helpful. There's a lot of different diets out there, weight loss diets, all of them work to some degree. So I think at a high level, my kind of thinking for, the average person just trying to eat a healthy, more slimming diet is eat foods that's lower calorie density, that is not hyper palatable, foods you can enjoy and that are satisfying, but that are not really pushing those reward buttons in your brain too hard. And try to eat mostly at meals. So not eating a lot between meals and not having food cues in your environment between meals. So you don't want to have stuff on the counter that you can just see and walk over and grab, and that's easy to eat. That is how your reward system gets triggered. Those sensory cues, the sight, the smell, even the location and the context where you've previously consumed foods. Those things, it's like Pavlov's dogs. It triggers those associations in your brain that generates that motivational state. Suddenly you have a craving. You might start to feel hungry all of a sudden. And then it's going to be hard for you not to eat that food. So set yourself up for success. Don't have food around, the sight of it, the smell of it. So that's controlling your food environment. I think that's also really important. And then I think also being regularly physically active, getting restorative sleep, managing stress. Those are other things that can make a positive contribution.